Hi everyone. Today I want to talk about neuropathy and specifically small fiber neuropathy. Now, what does neuropathy mean? And here it just means your nerve is injured. So there's different types of nerves and different ways it can be injured. And we can have these very specific terms for that, but that's just basically what it means. Now, here is a healthy nerve. So you got the body, the axon, and the ends of it are what we call the synapses. And these little like hot dog shaped things here, it's called myelin. That's kind of like, if you think of the nerve as on a copper wire as the copper, the myelin is the protective coating around the wire. Okay, that's what myelin is. And typical neuropathy involves, that's not traumatic, but chronic, like a thing that develops over time, is damage to the myelin here for one reason or another. And one of the most common reasons is just inflammation. Okay, now you can divide up neuropathies between large fiber and small fiber. And there's a lot going on here, so I'm just going to point out some differences. Both of these tend to start from the toes and work their way up. Okay. Large fiber neuropathy, large fibers are often involved more in your motor function, and that can be a problem. Your reflexes, where the doctor like takes that little rubber hammer and hits your knees to see if you have your reflexes there, balance, and so forth. And the large fiber is commonly diagnosed best by what's called the nerve conduction study. And they basically shock your nerve. And it's not the most comfortable thing, but that's how you do that. Small fiber neuropathy starts from the toes and works its way up, but it tends not to have motor function. Your reflexes are intact. And it's not only just kind of numbness, it's like painfulness to a point, or excessive, like even mild touch will hurt. Now, it can also start from the glove and work its way up, okay? Autonomically, with the autonomic nervous system, large fiber don't have any symptoms. Small fiber neuropathy, tons of autonomic symptoms, okay? That's a very important thing for me because people with large fiber neuropathy, they may have trouble, they're stumbling around, their reflexes aren't working right, but they aren't lightheaded, they don't have constipation or reflux and tachycardia. They don't have all that kind of stuff. Those are autonomic symptoms that you'll commonly see with small fiber neuropathy. And now the primary test for small fiber neuropathy is a skin biopsy. You get a biopsy. Often they do it like 10 inches or something like that above the ankle. They do this one particular place, but they might do it in the upper arm as well if that's predominantly where your symptoms are. So there are differences here between these two. And you don't need to know them in particular, just that they are different. And now, small fiber neuropathy tends to be from inflammation. And as you know, from any of my other readings, the majority of chronic inflammation that people are experiencing is coming from an imbalance of intestinal bacteria. And people call this dysbiosis. Actually, a more precise term is called SIBO, for small intestine bacterial overgrowth. Now this is a picture just in a very simple form showing the balance of bacteria. These forms of bacteria live in the small intestine. These represented by fish live in the large intestine. So this is roughly how we're laid out. And SIBO is where you have fish bacteria, so to speak, living in the wrong place. And in large numbers, it overwhelms the small intestine and literally fragments, molecules of the bacteria and viruses and other things in there can leak through into your body and can trigger a massive amount of inflammation, okay? And this, in my experience, is the primary cause of small fiber neuropathy. Now I want to go over a case because virtually every single patient's been told you won't get better. You're screwed. And In virtually every single patient I have, it goes away. Okay, so here's a case, 37-year-old woman, and this starts in the spring of 2021. She's traveling overseas. She gets rather severe gastroenteritis. It improves some, but she has some persistent diarrhea, especially like eat, gotta go kind of stuff. She also is developing now some autonomic symptoms. So she's got reflux, fidgetiness, muscle joint pain, numbness in her feet. So the numbness is her neuropathy starting, a little tremor, fatigue, lightheaded. That's pure autonomic stuff there, low blood pressure in the brain. Sees cardiologists, neurologists. They've done echo, which is the sound test of the heart, a stress test, an MRI of the head, nerve conduction study with the thing. That's looking for large fiber neuropathy. They don't find anything. Her symptoms persist, and she comes and sees me. So this is a year and a half later. But now the numbness has grown from just kind of in her feet to all the way up from her neck to her toes. It's really bad. She's not working. I mean, she's just miserable. And she's taking different drugs to try to block and numb this pain. She had just gotten a biopsy showing small fiber neuropathy. Again, remember, that's how you have to diagnose this. And but they told her there's nothing you can do. So she comes and sees me. She has these GI symptoms that are suggestive of SIBO that got triggered by that gastroenteritis. We give her twice a day of rifaximin. Now, rifaximin, the only thing rifaximin can do, it's a special antibiotic, but it takes you from this to this. Okay? So we give her that. And we also put her on our routine of the fish oil, the daily olive oil, and she was getting daily vagus nerve stimulation and dramatic improvement in, especially the GI symptoms resolved within about 2 weeks. Now, people, again, they say, how do you know you have SIBO? The only thing rifaximin can do is take SIBO and make you normal. So if you give it to somebody and they're better, you had SIBO. You don't need any fancy testing, okay? That's all you need. And she had really a significant improvement in her symptoms, and she was almost normal except for the numbness. Although it improved, it was still at kind of mid-thigh level down to the toes. I mean, she had a lot of relief from that. So we, instead of just that one course, she'd come back, we said, maybe you're relapsing some. Let's put you on 10 days a month, what I call monthly rifaximin. So it's twice a day. She stayed on her fish oil, olive oil, VNS, and her neuropathy kept getting better. And it was now kind of at the ankles to the toes. So it starts from the toes, works its way up, and when it gets better, it tends to go in the reverse. Okay? But what happens? She gets COVID. COVID just knocks the crap out of people. And it causes a huge inflammatory surge, which kind of just shocked all her tissue. Her neuropathy gets really bad again. It's back up to the hips area. Her autonomic symptoms are all returning. So she's pretty desperate. And so I'm trying to get this thing to get better as soon as I can. So from the monthly rifaximin, I said, let's just go to nonstop, twice a day rifaximin, which is more what I do up front now than trying the monthly. But we do that. Again, still taking fish oil, olive oil, the VNS. And it was around this time that the data was coming out about how COVID could cause this different kind of leaky gut. So we put her, and that it needs to be treated with L-glutamine. So the adult dose is a level tablespoon of powdered glutamine, okay, which is a level tablespoon is 15 grams. 15 grams twice a day is the minimum dose for adults. So we treated her with that. And within about 6 months, she's like a totally new person. I mean, autonomics are virtually, and her neuropathy are just completely resolved. And we were able then, at that point, we stopped the glutamine. You don't need that for the long term. We shifted her over to the fish oil. I mean, she stayed on fish oil, olive oil, and for long term, she was still using the VNS, maybe a couple days a week instead of daily. And the rifaximin we had just shifted to as needed because she would get this kind of very particular, like, eat and I gotta go to the bathroom sign for her SIBO. And so that's the only time she would take that. She wouldn't be on rifaximin until she had a couple days or a week. She might notice, oh my gosh, I'm having to go to the bathroom all the time after I eat. And she would take 10 days of rifaximin. And we saw her recently in follow-up. She's doing fantastic and is stable. Her symptoms are all gone. And so I thought I would share this with you, that small fiber neuropathy is very, very able to be reversed. You've just got to lower the inflammation. And her case is very typical of the wide range of people we see here with small fiber neuropathy. So hit the subscribe button. You get more of our stories. And maybe go to nemechekprotocol.com. We sell fish oil, the olive oil. We get books about the dosing that we use and things like that. And overall, everybody, take care of yourselves. Have a great day.